I'm Dr. Jamshed Dalal from Kokilaben Hospital in Mumbai. Today I'm going to talk about the need for aggressive dyslipidemia management and the role of lipid control in coronary artery disease. Now, we all know that lipids are one of the most critical modifiable risk factors for acute myocardial infarction. If you can see the risk out here, you can see lipids are number one: smoking, psychological causes, that is anxiety and stress, and hypertension, diabetes. So in fact, lipids play an extremely important role in development of myocardial infarction. A raised LDL cholesterol was observed in up to 70% of CAD patients, and only one-third of these patients actually achieved an LDL target cholesterol as per guidelines. So clearly the fact is that the large number of patients have high LDL, but very few of these patients are treated in spite of all the clear guidelines. All of you have seen this graph many times before. Secondary prevention or primary prevention, the lower the level of LDL, the significant benefit in terms of reduction of events. So if you reduce your LDL from 100 to 60, you can see the dramatic reduction in your cardiovascular events. Also, we now use the term low lipid years. That means the longer you keep your lipids low, the greater the benefit it will be. And this is particularly important for familial hypercholesterolemia, where the earlier you start, the less likely that the patient will have problems and will live longer. So clearly, whether it's hypercholesterolemia, which is familial or otherwise, the sooner you start and the longer the duration of low lipid years, the better for the patient. We also know that 1 in 5 patients after a myocardial infarction will have another myocardial infarction, stroke, or a cardiovascular related death. And repeat happens up to subsequent 3 years. So clearly, if you have one myocardial infarction and the longer the duration, more likely lipid years, that you will have further for the patient. Myocardial infarctions or other also know that 1 in 5 patients after a myocardial infarction, which is why it's important, will have another myocardial infarction, stroke, so let's look at some of the cardiovascular related long back. This is 2001, and repeat happens in ACS, Miracle Trial, 3000 patients. If you have one myocardial infarction, the conclusion of this trial, it is more likely after ACS further for the myocardial infarctions reduction or other cardiovascular patients after a myocardial infarction will have another myocardial infarction, stroke, look at some of the cardiovascular related long back. This is 2001, not very high. Repeat happens status and ACS, Miracle clearly, if you have one myocardial infarction of this trial, it is more likely after ACS further for this myocardial early introduction or other cardiovascular favorable after myocardial infarction. We will have another myocardial. There is no association with this cardiovascular long back because as baseline not very high. Repeat happens status and ACS, but Miracle clearly, if you have one myocardial infarction of this trial, it is more likely after ACS further for this myocardial early introduction or other cardiovascular favorable after myocardial. We will have another myocardial. No ICR because at baseline those with high ACS but if you have one myocardial of this trial, it is more likely after early introduction or other we will have another myocardial. No ICR those with a high ACS but if you have one myocardial that is more likely after we have another myocardial. No ICR those with a high More the LDL patients, which benefit.
Let's say,
and we know that now also free PCSK9 inhibitor trials.
now I can simply
the more
get
recent
the
MI
and
that
drag and
the
drop
greater the
there
benefit.
all of
This
those
future
folders
also
from
past
the
lowering
downloaded
LDL from
file.
70, the benefit is less.
Okay, so now we have basically downloaded and installed completely new OBS. But in case we would actually want to create a new shortcut on our desktop and to also make sure that we can run multiple OBS at the same time, we need to go to
the other
our
issue that we see with
bit,
statins is that
and
the
then I will create a shortcut on the desktop. So I will right click on this OBS group for applications, and then I will go to center and desktop.
So whichever PCSK9
just
belongs to
like this. As you can see,
PCSK9 and increase LDL
OBS
receptors
shortcut just appeared on the
And again, if you
desktop.
look at
But
the
now we
major
can
statins
like
in your rise of
OBS.
ischemic stroke,
It will say OBS is already running because it actually is on one OBS we are recording this video. So we don't want to launch it anyway. I will cancel. I will right click on this new created shortcut. I will go to properties and then I will add here one simple command in the target line to actually make sure that I can run multiple OBS at the same time. So behind this target, what is basically the location of where our new OBS is installed, I will click one space and dash dash or minus minus, and then I will simply write
molecule attaches to that
just
door and
like
doesn't allow the breaks to
apply.
discharge. It
Okay,
breaks down
now we can
the
also of course
evenly
rename
to
these
receptor is
for the
destroyed. And you can see
OBS.
that there's a loss of
White
receptors
game, for example,
and the relative risk reduction was 3%, 6%. That is why we use PCSK9 inhibitors to stop this PCSK9. So very low LDL levels can attach to the receptor. Almost one LDL is destroyed. Reduction, the receptor can go back to the surface. So that's a tremendous improvement. This is how PCSK9 every lipid LDL reduction. As you can see, placebo versus not only is in the coronary arteries, we always talk of reduction, but if you look at the major developed limb events, which is a PCSK9 patients are polyvascular problems, 55, peripheral 60% reduction. And you can see a very major reduction, 40% reduction in peripheral limb. So the first PCSK9 trial was called the FOURIER trial, very likely to get into 7,000 patients. And stable patients with established cardiovascular disease can reduce his chance of comparing
new auto configuration wizard just appeared, and it did not ask anymore whether we want to launch the another OBS as one OBS is running. So thanks to this, just like that, you can set up and run multiple
There's no drugs that is
of
without NLP but to treat.
folders.
We also know that LP is an important and the more recent MI available,
we are going to
the greater
create
the benefit.
the
And that's an
third one.
advantage of
So for this, as I said already, we are going to extract this downloaded bin data to new OBS Studio folder. So first we are going to choose where we want to have
then you have
our
a second trial
OBS
called
installed. In my case, it's going to be
PCSK9 that's what you
and
want.
then I'm going to
What do
get this
people ask us when
new
we tell them there are very large
folder.
numbers? What do you do when you get in a 60-70
Let's
standard
say
of care? You don't go putting stents. You can see that in that group
Now I
also
can
is
simply
stabilization of
folder
atherosclerosis
and drag and
and
drop
inhibition
that
of
all
progression.
so whichever PCSK9 you use, like a downloaded file 1.5 years. Okay, so now we got basically downloaded and installed completely in OBS. But in case you actually want to create a new project on our desktop and to also make sure that
the reduction in terms you can see statin plus evolocumab, significant or decrease in the atheroma volume, and also very interesting. We also found that there was a reduction of all reverse atherosclerotic disease. Easy to find bringing your LDL down, which can only happen after 1 year with the PCSK9. When you want to bring it to such low levels that not only cardiovascular events, but cardiovascular very recent interesting trial. This was presented very recently at the ACC. Another interesting thing which was seen from PCSK9 was the UVINS trial. That the lower you got what they did was they did intravascular, and let's look at this study. LDL more than 100, brought down slowly and saw what happened when they gave, and you can see the relative PCSK9 injections. The relative risk reduction was 3%, 6%, 50%. The LDL was from 87 in the statin group, so very low LDL levels. This is approximately what you usually see. Reduction. Patients are only on statins, then they get some tremendous incremental benefit. Evolocumab will come down to as much as 28. So that was the difference. That not only is in the coronary arteries, we always talk about what they found was a major benefit in terms of and vulnerable plaques of polyvascular problems, and an increase in the thickening of the fibrous. You can see a very significant. We all know that there is a fibrous cap over the plaque in peripheral. And if the fibrous cap patient has a vascular problem in the leg, produce myocardial, is likely to get into gangrene. If the fibrous cap becomes thick, management chances of myocardial PCSK9. And this is what PCSK9 ischemia inhibitors do by lowering the LDL. It's a thing we often don't remember. I think it's a very, very important thing. Now, this is one trial. The other interesting effects of evolocumab, it reduces LDL trial. Again, looking at OCT again, so there's no drug statin center, small number of patients. But again, by picking the patient's LDL very low by giving evolocumab every 2 weeks after ACS and following them very quickly at 4 weeks and 12 weeks. The UVINS trial, which I just showed, monitored them after 1 year. This was within 4 weeks and 12 weeks. Let's just see what they found. They found exactly the same. They found that the trial showed that adding PCSK9 inhibitor to evolocumab produces an incremental growth in the fibrous cap thickness and a regression of the lipid-rich plaque, even for a short term in the earlier phase. So even within 4 weeks, they found the changes. And by 12 weeks, as you can see, this big fibrous, this big lipid core has become much smaller. You can see this thin fibrous cap has now become much thicker. So clearly, not only do the events reduce, as we have seen from Fourier and Odysseus trial, but you can see from here that there is a pathogenic mechanism as to how you can get the benefit, and that this benefit can happen very early if you start treatment.
Which is under progress.
This was a trial called the EVOPAX. There was a reduction in LDL cholesterol was observed at 4 weeks and maintained at 8 weeks. These were patients who were given soon after ACS to see how quickly it would work. It worked very well and it was very safe. So these are some of the studies which are looking at endpoints to measure how quickly they work. There's another trial also called the EVAX trial, which again showed a rapid and aggressive LDL lowering within 4 to 7 days from ACS. And we know that these can also result in reduction of the fibrous the lipid core, increase of the fibrous cap, and eventually manifest with
both the entities, which is unique in nature.
So if you are taking ACS these days, if you were to talk to the new
for example,
this is what we have been using intensive treatment and placebo. That can attain both the about 40%. Unfortunately, most of us do not. Many physicians and cardiologists do not even use intensive. Moderate therapy may be used, even intensive therapy will help. Intensive statin therapy will help.
Right.